Men over 55 need to know. Warning signs of prostate cancer. Imagine a 55-year-old man, living a healthy life with no history of serious illness. Everything seems normal until he starts waking up multiple times at night to urinate. At first, he thinks it is just a sign of aging. But then, his urine stream gradually weakens. And at times, he feels discomfort in the pelvic area. He continues to ignore it, assuming it is nothing serious, until he goes for a checkup and discovers that he has advanced stage prostate cancer. This is not an uncommon story. In fact, prostate cancer is one of the most common types of cancer in men, especially after the age of 50. What is concerning is that many people fail to recognize the early signs or dismiss them, missing the opportunity for early treatment, when the chances of a cure are still very high. Symptoms such as difficulty urinating, a weak urine stream, pain during ejaculation, or even prolonged fatigue can be the body's early warning signs. However, if detected in time, prostate cancer can be effectively managed with available treatment methods. So, what are the specific warning signs? Who is at higher risk? And how can it be detected early? Let us explore these questions right now. The prostate is a small gland in the male body, located just below the bladder and in front of the rectum. Although it is only the size of a walnut, this gland plays a crucial role in the reproductive system. It is responsible for producing part of the fluid in semen, which nourishes and protects sperm, ensuring that they can survive and function properly as they travel through the female body. With such a special location and essential function, any issues affecting the prostate can impact men's health. One of the most serious threats is prostate cancer, when the cells in this gland begin to mutate and grow uncontrollably. A tumor can form. Initially, this disease progresses silently, without causing noticeable symptoms. This leads many people to overlook or dismiss the body's abnormal signals. However, over time, prostate cancer can cause a series of severe problems. Patients may experience difficulty urinating, pain in the pelvic area or lower back, and even disruptions in their sexual health. As the disease advances, cancer cells can spread to other parts of the body, posing a direct threat to life. So, how can one detect the early signs of this dangerous disease? Who is at the highest risk? To safeguard their health, men need to understand the warning symptoms and the potential risk factors. Imagine a middle-aged man living a healthy and busy life. He has no unusual symptoms, goes to work every day, plays sports on weekends, and enjoys time with his family. One day, during a routine health checkup, his doctor suggests a PSA test, a simple test that can help detect prostate cancer early. At first, he hesitates, thinking he is still healthy. But after some consideration, he decides to follow the doctor's advice. The results show an unusually high PSA level, and after further tests, he is diagnosed with early-stage prostate cancer. Thanks to early detection, he can undergo a minimally invasive treatment, recover quickly, and continue his life as usual. This case is not uncommon. In its early stages, prostate cancer often has no noticeable symptoms. Many men remain unaware because they do not experience pain or any unusual signs. It is only when the disease progresses that they begin to notice changes such as difficulty urinating, pelvic pain, or even blood in the urine. At this stage, the tumor may have grown larger or spread to other areas, making treatment more complex. The PSA test and digital rectal examination are two methods that help detect prostate cancer early. The PSA test measures the level of prostate-specific antigen in the blood, providing a warning sign even before symptoms appear. The digital rectal examination allows doctors to check the size and condition of the prostate to identify abnormalities. If cancer is diagnosed early, treatment methods such as localized radiation therapy or laparoscopic surgery can effectively remove the tumor with fewer side effects. On the other hand, if the disease reaches an advanced stage, treatment options become more limited, often requiring chemotherapy or hormone therapy, which can significantly impact health and quality of life. Therefore, instead of waiting for obvious symptoms to appear, men should take the initiative in scheduling regular health checkups. A simple test today could save you from a difficult battle in the future. Imagine two men of the same age, working the same office job, but with different risk factors for prostate cancer. The first man, Mr. John, is 55 years old. He has never had any serious health issues. But his father was diagnosed with prostate cancer in his early 60s. Even though he has no symptoms, Mr. John falls into a higher risk group due to his family history. Science has proven that if a close relative has had the disease, your risk of developing prostate cancer is twice as high as that of the general population. The second man, Mr. Robert, is also in his early 50s but leads a sedentary lifestyle. He spends most of his time sitting in front of a computer screen, exercises infrequently, and often consumes fast food high in fat. This diet not only affects his weight but also increases his risk of developing prostate cancer. Studies have shown that a diet high in animal fat can promote the growth of cancer cells. While obesity is linked to advanced stage prostate cancer, beyond age and lifestyle, race is also a significant factor. Statistics show that black men, particularly those of African descent, have a higher risk of developing prostate cancer and are often diagnosed at later stages compared to other groups. While factors like age and genetics cannot be fully controlled, maintaining a healthy lifestyle, exercising regularly, and following a balanced diet can help reduce the risk of the disease. More importantly, individuals at higher risk should take the initiative to undergo regular health checkups to ensure early detection and timely treatment if necessary. Do you ever find yourself waking up multiple times during the night just to urinate? At first, you might think you drank too much water before bed, but then you realize the frequency is increasing over time. Your sleep is disrupted, and every morning, you wake up feeling more tired than usual. Not only that, urination becomes more difficult. Your urine stream is weak, sometimes intermittent, and you still feel like your bladder is not completely empty, even after just finishing. This is not only uncomfortable but also affects your daily life. Then one day, you notice a small trace of blood in your urine or semen. An unusual sign that is easy to overlook. You tell yourself it is probably nothing serious. But if this persists, it could be an early warning sign of prostate cancer. Dull pain in the pelvic area and lower back also begins to appear, especially when sitting for long periods or engaging in strenuous activities. There is no prior injury, no clear cause, yet the pain lingers, making you feel uneasy. It does not stop there. Your sexual health also starts to change. The amount of semen decreases, ejaculation becomes painful, and even erectile dysfunction begins to develop. You may think it is due to stress or aging, but in reality, it could be a serious warning sign. One of the most overlooked symptoms is unexplained weight loss. If you have not changed your diet or exercise routine but are still losing weight, feeling increasingly sluggish, and experiencing prolonged fatigue, it may be a sign that something is happening inside your body. Each of these symptoms on its own may not seem alarming, but when they occur together, do not ignore them. Early detection can make a significant difference in treatment and in protecting your health. Diagnostic methods for prostate cancer play a crucial role in detecting the disease at an early stage, increasing the chances of successful treatment. One of the most common tests is the PSA test, which measures the level of prostate-specific antigen in the blood. When the prostate gland has issues, PSA levels may rise. However, this does not necessarily mean cancer. Doctors will evaluate PSA results along with other factors before making a conclusion. In addition to the PSA test, a digital rectal exam is a simple yet effective method. The doctor uses a gloved finger to check the size, texture, and firmness of the prostate gland through the rectum. If abnormalities such as enlargement or hard lumps are detected, further imaging tests such as ultrasound and MRI may be ordered. A transrectal ultrasound provides detailed images of the prostate, while MRI helps assess the extent of tumor spread. If cancer is suspected, a prostate biopsy will be performed to collect tissue samples for microscopic examination to confirm the diagnosis. Once prostate cancer is diagnosed, the doctor will choose an appropriate treatment method based on the stage of the disease and the patient's overall health. If the cancer is still localized within the prostate, prostatectomy may be the best option, by removing the entire prostate gland and surrounding tissues. This procedure aims to completely eliminate cancer cells and reduce the risk of recurrence. If surgery is not a suitable option, Radiation therapy may be used to destroy cancer cells with radiation beams. Radiation therapy can be administered externally or by placing a radioactive source inside the prostate to target the tumor directly. For cases where cancer grows based on male hormones, hormone therapy is used to lower testosterone levels, thereby slowing the growth of cancer cells. This method is often applied when the cancer has spread or is not operable. In later stages, when the cancer has metastasized to other parts of the body, chemotherapy is the chosen method to destroy cancer cells on a larger scale. Chemotherapy helps extend survival time and alleviate symptoms but may also cause significant side effects. The choice of treatment should be based on a doctor's consultation and the specific condition of each patient. Early detection remains the most critical factor in ensuring effective treatment and improving quality of life. Maintaining prostate health is an essential part of overall male well-being, especially as age increases. Nutrition is the first factor to consider. A diet rich in vegetables, fruits, and whole grains not only provides essential vitamins and minerals but also helps reduce the risk of inflammation and cell mutations. On the other hand, excessive consumption of red meat, processed foods, and saturated fats may increase the risk of prostate cancer. In addition to diet, regular physical activity helps control weight, promote blood circulation, and improve prostate function. Exercises such as walking, jogging, yoga, and swimming offer significant benefits. Maintaining an active lifestyle not only strengthens the body but also supports mental well-being and reduces stress, an often overlooked factor that can negatively impact prostate health. Routine health checkups are something many men tend to neglect, yet they play a decisive role in early detection of abnormalities. For men over 50 or those with a family history of prostate cancer, regular screenings become particularly important. PSA tests and digital rectal exams can detect early warning signs, allowing timely medical intervention. Another crucial factor is stress management. Maintaining a positive mindset, combined with relaxation techniques such as meditation, yoga, or engaging in personal hobbies, can help regulate hormonal balance and lower the risk of prostate issues. Despite the importance of preventive measures, many men still avoid medical checkups due to reluctance or discomfort. One of the most common barriers is the hesitation toward digital rectal exams, a simple procedure that plays a vital role in early prostate cancer diagnosis. In reality, this examination is quick, painless, and can help detect concerning signs at an early stage. Thanks to awareness campaigns, more people are recognizing the significance of men's health screenings. Breaking stigmas and shifting perceptions about routine tests not only helps protect individuals but also demonstrates responsibility toward family and loved ones. The more proactive men are in taking care of their health, the greater their chances of living a longer, healthier life. Health is the most valuable asset, and the prostate, despite its small size, plays a crucial role in a man's life. Recognizing early warning signs not only increases the chances of successful treatment but also helps prevent serious complications in the future. A simple action, such as regular health checkups, can make a significant difference and even save your life. Take charge of your health today. Do not let psychological barriers or complacency cause you to miss the golden opportunity for early detection and treatment. A small habit, a wise decision, can help you maintain a healthy and happy life with your family and loved ones. If you found this video helpful, please like and subscribe to the channel to stay updated on important health information. Do not forget to share this video to spread awareness to more people. Thank you for watching, and see you in the next video.